Hello, this is Dr. Feast Price, and I'd like to continue our discussion on family therapy approaches for week 8 by moving on to strategic family therapy. Strategic family therapy was developed by Jay Haley, and it's not a particular approach or theory, but a name for the type of therapy where the therapist takes responsibility. And the goal for strategic family therapy is working with the family to define a problem and then helping the family to relate to and solve the problem. So another way of looking at strategic family therapy is actually problem-solving therapy. So asking the family, what is the problem? And then helping the family to identify systemic ways of solving the problem. So it's not a particular theory. However, it is a way by which a therapist takes responsibility and work with the family. As it relates to maladaptive behavior, strategic family therapy emphasizes the role of communication in maladaptive behavior, especially in terms of controlling behavior. It also focuses on symptoms that are usually interpersonal, recognizing that many of the problems that exist within a family system is due to communication malfunctions. And there is a focus on some of the struggles of control that may become pathological when one or both parties deny his or her intent to control the other person that causes symptomatic behavior. So it's the struggle of control that becomes pathological when one or both parties deny his or her attempt to control the other person, which causes the symptomatic behavior. Specific to the treatment goals of strategic family therapy, the focus is on alleviating current symptoms through altering a family's transactions or ways of relating and its organizations. So you're focusing on some of the hierarchies that exist within the family. It might be with the adults or sometimes with the children, and some of the generational boundaries that exist. So the goal is to achieve insight into some of the counterproductive ways of behaving that might be the cause of resistance that exists within the family structure. So strategic family therapy suggests that by targeting the entire family constellation, the counselor attempts to expand the family's resources, and this expansion brings about change so that the family no longer considers the child as the problem, but rather concentrates on becoming more equipped to handle the family crisis. So again, rather than identifying a particular individual within the family as the problem, the focus is on the behaviors and specific changes that must take place in order for the family to function in a more cohesive and constructive manner. So there are 9 needs for success in strategic family therapy, and it begins with the fact that the family must ask for help. You can't superimpose therapy on a family who doesn't believe that they are in need of help. And when there is an acknowledgement that there is a need of help, they then hire the counselor so that the counselor is not thrusted upon the family, but they are invited to work with the family. The family must be in agreement with the counselor about what has to be changed. So rather than the therapist making the decisions on those areas within the family that must be addressed and changed, it's the family that's driving the changes that must be made within the family. So the problem needs to be changeable. However, it may not be, it must be changeable and not incurable. So whatever the problems are that are identified, it must be something that can be changed. So if they might identify a person with a disability as the problem, no, that person isn't the problem. The problem is the way in which people function and cope with some of the challenges that might exist with the person with the disability. So rather than recognizing incurable issues or inchangeable factors that's the problem, sometimes it's best to identify those issues that are most likely to be changed, because if the change factors are incurable, then in essence the family doesn't evolve or grow but stay in a particular stagnant place. And so when behaviors can't change, oftentimes one's perceptions or ways of relating to those issues can change, and that in and of itself can be impactful and successful within the family system. There must also be an agreement that the family problem will be solved without expelling anyone. So no one has to be disassociated from the family in order for some of the family problems to be solved. And also change must occur in the same environment in which it started. So rather than people feeling like they have to move out in order for the problems to be resolved, the change must occur in the same environment in which the problem started. Number 6 says that the family must have confidence in the counselor, and each family member must feel connected to the counselor. So this speaks to the importance of relationship. Without the sense of trust and rapport within the therapeutic relationship, it's unlikely that strategic family therapy would be successful. And this is different from some of the other forms of therapeutic approaches, like if you consider behavioral family therapy or structural family therapy, there's less emphasis on the relationship. However, with strategic family therapy, it is the belief that without a coherent and trusting relationship with the counselor, not only with some members, but each of the members of the family, it's less likely that the strategic family therapy approach would be successful. And the referring party comes to the first session to assure that the family is in charge of their treatment. So let's say maybe the grandfather of the family refers the family for therapy, so that person would attend the therapeutic process. However, they wouldn't remain as a part of the therapeutic process, but instead they attend the first session to assure the family that the counselor is in fact in charge of their treatment. The counselor must spearhead the treatment, so all decisions regarding the treatment process must pass through the counselor. However, this isn't done without the support of the family, as they are the ones that are identifying the problems and some of the ways in which they would like the family to be better as a result of the therapeutic process. So there are various techniques that exist within the strategic family therapy process. And the first session is believed to be the most important session, and it is also highly structured, and it involves 4 primary stages. And the first stage is the social stage, the second stage is the problem stage, third is interaction, and fourth is goal setting stage. So first, within the family therapy context, with the social stage, it observes the family's interactions and it encourages the involvement of family members. The second stage of the first session is the problem stage, whereby the therapist gathers information about the reasons why the family came in for therapy. And in the interaction stage, the family members discuss the identified problems, and the therapist observes the interactions within the family in order to gather relevant information. So not only is the therapist obtaining information based upon what is verbally communicated, but information is also collected based upon observations. And the fourth stage that is specific to the first session involves the goal setting stage, and that includes the therapist and family members agreeing on a contract that defines the goals of treatment. So the role of the therapist is assumed to be one that is active, take charge. The therapist utilizes a variety of techniques that are tailored for the family and the specific problems that are identified. A therapist employs strategic therapy must identify solvable problems, set goals, design an intervention that allows them to achieve the goals. And for me, what comes to mind are some of the objectives, and then you have the sub goals that are, some of the smaller goals that lead to the ultimate goal. The therapist must also examine some of the responses and examine the outcome of the therapeutic process. So in a nutshell, what's identified here, these steps include the role of the therapist in strategic family therapy. So some of the key terminology that is specific to strategic family therapy includes family rules, and those are some of the overt and covert rules that exist within the family, and they use these rules to help govern the family system. Sometimes it's the role of the therapist to help change the family rules into those that are more functional for the entire family. There's also family homeostasis, and that's the tendency of a family to remain in the same pattern of functioning unless challenged to change. And so the therapist find instances where sometimes the family homeostasis might have to be disrupted in an effort to bring about more holistic and normal family functioning. Quid pro quo is the tendency of family members to treat others in the way they want to be treated. And the redundancy principle is the family's repetition of limited behavioral sequences. So when a family has limited behavior, they typically respond in ways that are repetitive. And so the goal of the family therapy is not only to identify appropriate quid pro quos or exchanges within the family, but also to help with the redundancy principle, thereby disrupting the redundancy and identifying more effective ways of functioning within the family. Punctuation is a terminology that speaks to the belief that what individuals say is caused by what others say, and so helping individuals to become more individualized in their thinking rather than behaviors that are simply carried out based upon what others are saying and doing. Symmetrical and complementary communication, and we talked about this a few weeks ago, and symmetrical communication is the communication that exists between two equals within the family, and complementary is more of the top down, top dog, underdog kind of communication. There's also circular causality, whereby events are interconnected, and it's to help the family to recognize how certain behaviors cause multiple factors. And so included is like the domino effect in helping persons to understand how certain specific actions within the family are interconnected and sometimes might cause what is perceived as a domino effect within the family. A primary technique in strategic family therapy is directives. So the therapist gives directives to family members, and oftentimes it could be an assignment whereby persons must perform activities outside of therapy. And for me in my clinical practice, because I recognize the fact that through managed care, most people only have 6 to 8 sessions, it's important that you give them homework. So I always give my clients homework. And with the homework, it's expected that the work that they do outside of the treatment will continue to foster some of the growth and development that's needed. Straightforward instructions, paradoxical interventions, ordeals, restraining, reframing, and prescribing the symptoms are all directives that exist with strategic family therapy. So with straightforward instructions, it might include a father who always intrudes when his wife and son are arguing, and they might be simply told, when the wife and son are arguing, do not intrude. It might be a paradoxical intervention where you use the client's resistance in a constructive way. So if the person is not wanting to do something in particular, then you find constructive ways of getting them to do what they don't want to do. Ordeals are an unpleasant task a client must perform whenever a symptom occurs. So for example, if the problem is that the son-in-law always says negative things about the in-laws, whenever this occurs, then he must buy the mother-in-law a gift. Or if he's always arguing with the mother-in-law, which causes disharmony within the family, the ordeal may be that a gift must be purchased every time this unpleasant situation occurs. And by doing so, it gets their attention and causes them to be more aware of and likely to change the unhealthy behavior. Restraining is another technique that is sometimes used by strategic family therapists, and it involves encouraging the family to not change, just to stay the way they are and not change. And by encouraging the lack of change, most often the family will find that it is necessary to change, because to remain the same is counterproductive. Reframing is placing the symptom in another frame of reference. So rather than identifying the problem the way in which they do, they can reframe or develop a different way of seeing, viewing, or understanding the situation that they're focused on. And prescribing the symptom is instructing a family member to deliberately engage in the symptom. So if it's a husband and wife that's arguing a lot, you might tell them, okay, so go home and you can argue as much as you want over these issues. And then when you come back, the issue, we will no longer deal with this issue anymore. So you prescribe the symptom with the expectation that by deliberately engaging in that behavior, it will disseminate and the problem will then become lessened. So in a nutshell, this gives you an overview of strategic family therapy. Please know that there are a number of techniques that exist within all of these therapeutic approaches. And the goal for this lecture is to help orient you to some of these tools and techniques that would allow you to identify those that would be best suited in your toolbox and you can pull out and use when working with families that come in for services. So that is the end as it relates to strategic family therapy. Our next lecture will focus on solution-focused therapy.